let's review what we're going to accomplish in learning unit number 6 for our course in resilience. In this unit, as in the others, we're going to continue with our individual resilience practice of 3 Good Things journaling and heart rate variability biofeedback. I did post recently another announcement just giving you a little bit more guidance on your heart rate variability biofeedback practice. Please make sure that if you're hooking up in the evening and perhaps using it as a tool to go to sleep, that's not how it was set up to work. That it is different than a relaxation technique, and it's important to be alert, be relaxed, but the main thing is generating that positive feeling of gratitude, love, compassion, and following through as far as your breathing. So just wanted to remind everybody, perhaps you're not as satisfied with it if you're trying to utilize it as a relaxation tool and go to sleep with it at night, or nap with eyes closed. So while continuing to build our own resilience, we're also going to apply systems thinking to change the design and organization of clinical work to both prevent and to mitigate burnout. We're going to take a systems approach to professional well-being and resilience by looking at high reliability organizations, HROs, and especially the work of the National Academy of Medicine's collaborative on clinician well-being and resilience. And in addition, what I'm thrilled with is that we're going to read a chapter from Compassionomics. This has been written by 2 physicians in New Jersey. One is they're both practicing physicians, and Treziak and Mazzarelli, and it looks at the evidence on compassion as an antidote to burnout. So again, as an antidote to those who are suffering from burnout, as well as a preventive measure. So I am looking forward to your experience with this one chapter that's going to be available on this course site, and hearing your take on the evidence in the discussion board. So at the end of this learning module, you're going to be able to explain how job demand and job resource, how an imbalance between these two leads to stress and burnout. Propose how high burnout rates among healthcare workers demonstrates a failure of our healthcare system. So we're not looking at the individual as a failure, but it's high burnout rates among healthcare workers demonstrates a failure of the system, of our healthcare system, to meet its goals. We're going to look at work systems that facilitate teamwork, collaboration, communication, and professionalism, and that nurture organizational resilience. So we're really focused on organizational resilience. And then, of course, explore the evidence on compassion as an antidote and preventative measure to burnout. So you're watching this video, you're doing your heart rate variability biofeedback practice, you're doing your 3 good things, and you're uploading that information. You're reading chapter 10 of this book that was published in 2019, Compassionomics. It's been just probably one of the most enlightening books I truly have read. And they also have published a more recent book called The Wonder Drug, and similar in content, but kind of they expanded out to all people, non-healthcare workers as well. And while I like that book, it's more recent copyright date. I would think that would be important. I just found Compassionomics to meet me at my heart of nursing. So really to be at the core of nursing, and just really timely especially seeing that it was published right before the pandemic. Just excellent information. And going forward, we're going to, for future students, we're going to be reading either Compassionomics in its entirety or The Wonder Drug for our vulnerable populations course, because I think it really fits beautifully. So then we're going to look at the website of the American or the AHRQ as far as high reliability organizations. So you're going to be coming back to that website during the summer course of 573, but it's important that you look at the information specifically to HROs, and that's going to be on this website. An article that is very recent, talking about how resilience starts with healthcare organizations. And if healthcare organizations are indeed high reliability organizations and are resilient organizations, then individual resilience will follow. So this is really changing our focus from the individual first, all the factors as far as practicing heart rate variability, biofeedback, which is important, but looking at a different perspective, looking at the system's perspective. And then this is a brief that was done by the National Academy of Medicine, a report, and I just highlighted the one table. It's only a 2-pager, but the role of healthcare leadership. But I wanted you to reflect on, and you're going to reflect on this in conjunction with your other articles and especially Compassionomics chapter in the discussion board about job demands, which I think we all are pretty familiar with, but we'll talk a little bit more about moral distress at the very end of this course. We're close to it, but not quite there. And so job demands, which we all seem to experience, and job resources, especially meaning and purpose in work, which we've gone a lot over the joy in work, but how that is a resource. So that said, and I'm just making sure that you know what the National Academy of Medicine is, because it used to be called the Institute of Medicine. So this isn't anything you click on, it's just a little bit more information. And with that said, you're going to do your discussion board 6. So we know that the National Academy of Medicine demonstrates that finding meaning and purpose in work is a job resource for healthcare professionals, and that an excessive workload and inadequate staffing is one of the barriers to finding meaning and purpose in work. So for this discussion board, I want you to do a scholarly post sharing what is the evidence according to our physician authors in Chapter 10 on Compassionomics. What is the evidence that compassion helps us to find meaning and purpose in work and can prevent or act as an antidote for burnout among healthcare professionals? So it's really a reflection. So as you're reading your chapter, you are also reflecting on that and looking at the evidence, because that's what their book is all about. And it's, it's talking about that they went about this not opinion-based, but evidence-based. So, the one author is a physician who is a physician researcher. He also is an intensivist. So, he's in clinical practice, but he sees himself, his main skill, as a researcher. And so this book, while you think, wow, it's a pretty fluffy topic or a spiritual topic, which it is, we're talking meaning and purpose, but when you think about compassion, and I have a quote of the Dalai Lama at the very beginning, you're going to see that compassion is finding meaning and purpose in our work, and compassion is one way to find that meaning and purpose. So I'm excited about this reading. Can you tell that? I am really excited to share Compassionomics. If you've not already read it, I know it seems to be in a lot of leaders. It's entering into the literature that many nurse leaders and hospital executives are now being exposed to and buying into. So I want you to read that and respond. And the final that I'm also looking forward to is your resilience praxis assignment. It is due at the end of this module, and that's your StoryCorps interview. So I hope you've had fun with this or have fun with this if you haven't gotten to it yet and are doing it this week. If for any reason you know that you need a little extra time to make this happen, please let me know. We are nearing the end of the semester, but I respect that you may just need a couple extra days. So please let me know. Otherwise, I'm looking forward to reviewing those. Thank you. Have an amazing week. And I think you're going to really enjoy Chapter 10 of Compassionomics. I certainly hope so. I certainly hope that it's the hook that you take and get yourself a copy from the library or a used copy on Amazon and read the book in its entirety. Thank you.